Okay, ladies, listen up. Some health guidelines for women are now changing, especially when it comes to pap smears. Local gynecologist Dr. Somi Javaid is joining us now live to break it all down. Doctor, first of all, thanks so much for joining us.
Thank you.
These are some new guidelines. Specifically, why these guidelines seem to change a lot when it comes to health situations? You know, sometimes you should do this and not this, or get this exam. Why did this even come about to begin with? Tell us more about this.
The guidelines changed because they were feeling like we were making too many interventions, and bringing patients in too rapidly can actually cause more harm than good. Most cervical cancer cases are associated with the HPV virus, and a lot of young women can clear the virus on their own within the first 2 years after being exposed.
Now, it used to be these were annual tests that you would have performed. At what point, you know, obviously, what are the new guidelines? How often should women have these tests at this point?
So the game changer, which is new to doctors as well as patients now, is that we are now no longer recommending pap smears until a woman is 21.
Okay.
Between 21 and 30, she can now not have a pap smear every year, but go every 3 years. And after 35, this is the first time that they're recommending that they can actually have a pap smear with HPV testing, which is the virus that we spoke of, every 5 years. And that has never happened before.
These recommendations being widely accepted throughout the medical field at this point?
Not yet. The U.S. Preventative Screening Task Force has just brought these up. They're relatively new, just came out last month. The American College of Obstetrics and Gynecology and the family physicians still looking at it, determining if this is really the smartest way to go.
Certainly sounds like you may have some patients who still want to get an annual checkup just to be safe, and you would certainly not recommend against that, correct?
No, despite the pap smear every 5 years, if that is where the patient falls, she has to look at her own history, and also she still needs to come in for that breast exam and that ovarian cancer screening that we still do every year.
All right, doctor. Well, we appreciate your time and outlining some of those new guidelines in the female health field. Always a pleasure to see you, and thanks for your time.
Thank you.
Well, still ahead, Easter.